It's been a Haye and welcome to Mommy Diaries, the show we talk about all things motherhood, parenting, and this wonderful journey of raising our kids. Kitsamale Dr. Sihle Sibiya. She is a pediatrician, and we're going to talk about 6 months of a child's life, the first 6 months of a child's life. Doctor, thank you so much for coming, and welcome to Mommy Diaries with Pasi.
Thank you,
How
Pasi.
are you doing?
I'm doing great.
Yes.
It's good to be here.
Thank you so much. Let's talk about you. Kimang, who is Sihle? Where is she from? Before we could even think of calling you a doctor. That little girl, Sihle, from Durban, how was she and how did you end up where you are today?
So, as you said, I am Sihle Sibiya. I grew up in a township called Imlazi in Durban. Ever since I can remember, I wanted to be a doctor. But then during my training, I fell in love with pediatrics. And that's the journey that led me here. I'm currently practicing in Johannesburg at a Netcare hospital in Midrand.
And how's that been going so far? You are clearly living your dream.
Definitely.
Yes.
It's amazing. It's
Yeah.
such an honor and a privilege to practice pediatrics and to be part of these babies' lives. I've learned a lot from my patients as well as their mommies.
Yes.
So it's been incredible.
Yeah. So now, obviously, the show is about motherhood. The show is about anyone who's pregnant and they don't know what to expect. Let's talk about the topic for today, the 6 months of a child's life. I think it's a very crucial time because as a mother also, you're trying to find yourself. And here's this little baby, who's looking at you for you to raise the baby. Let's talk about how important it is this time, this 6 months.
So the first 6 months are there's a lot that happens. There's a lot of growth within the baby. There's a lot of changes in the baby, and there's a lot of adjustments that the mommy has to have. So I think it's crucial because it's also the time when mommies learn the baby's personality and they're adjusting to life outside the womb, so to speak. I think a lot of times moms put a lot of pressures on themselves when they should in fact be responding to the cues that the baby's getting, relaxing, trusting herself, being intuitive, because there's a reason that baby chose you as a mom to enter the earth.
Yeah.
And so you are a correct fit for that baby. So just trusting yourself a little bit more. And then obviously seeking advice if you're not sure as to what's happening with the baby.
Yeah. I saw on your TikTok, you advocate a lot for breastfeeding. I'll share my story. I breastfed for 2 years.
Wow,
Yes.
well done.
And I think if I didn't tell her to stop, because there was a time when I wanted to take treatment for my skin, but I think if I didn't stop, she was gonna go on and on and on. I enjoyed breastfeeding. It made me feel like I'm a superhero, And now I saw you advocated a lot. Let's talk about the importance of, because we are within that 6 months, and obviously doctors would advise that we have to feed the babies and breastfeed them. So how important it is to breastfeed and give them that breast milk.
So breast milk is very important. In all occasions, we do promote breastfeeding for all moms and babies, especially if there's no medical reason not to.
Yes.
Currently, the WHO is advocating breastfeeding for 2 years and beyond. So you're welcome to push it. But the reason breastfeeding is so important is that it has benefits for the mom, for the baby, and long term. So it's not just at the time while you're feeding the child. The milk is readily available. It's the correct nutrients, ready at the right time, at the right temperature. It obviously helps mommy with just recovering from the pregnancy. She also has protective features in terms of her health. The baby is protected from infections. The baby is at a higher chance of surviving if, for example, she gets a flu or there is a gastro. Also long-term in terms of protection for obesity. We found that in breastfed babies, they don't have as much incidence of long-term chronic illnesses. So I can't stress enough the importance of breastfeeding and just doing your best. I think a lot of the time, because we preach exclusive breastfeeding, I find a lot of moms who struggle feeling bad about it. I always just say, do your best. Our aim is to exclusively breastfeed and to breastfeed up to 2 years and beyond. But if you don't get there and we need to supplement, then that's okay. But just know that we aim really, really high, and then see how we go as we go along. There's no reason to to feel bad if you are not able to get to that point, as long as we're trying our best every step of the way.
And what about some of the moms? So some of the moms, it's not like they don't want to breastfeed. You will hear stories about, I didn't have enough milk and whatnot. Are there any, whether supplements or any certain things that we need to eat to help to increase maybe the breast milk? Because sometimes you would hear someone say, I really wanted to do it, but I had no milk. But also we hear these things of, when you have smaller boobs, you have more milk. Ladies with big boobs don't have milk. I don't know if it's a myth or if it's true.
So most of those things are myths, but there's definitely a lot of mummies that do struggle with breastfeeding.
Yeah.
And as much as the biggest contributor to breast milk production is actually the baby sucking on your breast. Yes. So that's the first thing. In terms of supplements, a lot of them are herbal. There hasn't been enough evidence that they work, but some mummies will say that Stony helped her, for example. Yes. The midwives loves that ginger beer or Stony helps them. I think it's just important to look after yourself as a mom. Make sure you are well hydrated, you are eating well. You don't have to eat dog 3 times a day like my mom made me do. As long as you're healthy, eating well, and doing your best, and actually putting the baby to the breast regularly. I also encourage putting the baby to the breast at night. The hormones that produce breast milk are higher at night. So those night feeds regularly will increase your production. And then obviously doing your best. In terms of small boobs, big boobs, all boobs produce breast milk.
Come on, 100%. Yes.
So it's really just to do your best, put the baby to the breast, and take it from there.
Now, introducing solids. This is like a whole debate, like it's a topic on its own, because within that 6 months, some would say, my midwife said that I can just feed my daughter without introducing solids within the 6 months. But now you hear different stories that that's the right time. Maybe when the child is 6 months, you can introduce solids. Is there a particular time where we need to start introducing solids, or we just have to see how it goes?
So definitely, by the time the baby's 6 months, you do need to introduce solids. The breast milk and the infant formulas are no longer enough to provide the nutrients that baby requires. So up until 6 months, I think the confusion started when there was a big allergy study that showed that earlier introduction in allergy-prone babies could be protective for allergies. So we became a little bit more flexible in terms of allowing moms to, if the baby is ready at around 4 months, between 4 and 6 months, they can start, I call it tasting food, but the real eating, and our cutoff would be 6 months. So the cues you're looking for is a baby that can hold up her head, a baby that shows that she's interested in food. So while you are eating, you'll see that her eyes will light up, they start to salivate, some of them, and you can see that they even swallow while you're eating. That's a baby that's interested in food. And also signs of hunger. So you might find that you've breastfed and typically your baby feeds every 3 hours, and suddenly an hour later it's not enough. So that might be signs that she or he is ready for solids. But whether that baby is ready or not, 6 months you almost have to start.
Now, the other part that stresses a lot of moms, sleeping habits. I slept with my daughter for long, and now it's bad because she doesn't want to get off the bed. I used to sleep with her a lot because 6 weeks after I gave birth, I had to go back to set. So most of the time I'd come back tired, and this whole thing of, creating that beautiful nursery and putting her to bed, it didn't work for me. I used to put her next to me and just feed her. But now it did affect the sleeping, the routine. How important it is to start the routine within that time, within the period of 6 months.
So from a medical perspective, we advocate that the baby sleeps next to you within the bed. Not inside your bed. So I know in terms of breastfeeding and the ease of breastfeeding, co-sleeping is easier. But in terms of protecting the baby from SIDS, or sudden infant death syndrome, where the baby can't stop breathing within your bed, it's been safer for the baby to sleep in a cot next to your bed. So that's what we advocate from a medical perspective. It is important to try and get that baby into a sort of routine, also for your sanity. I mean, look at you, you went back to work so easily, so quickly. So imagine that baby staying up the whole night to play. it's not feasible for you to be able to go to work the next day. So it is nice to get baby into a routine. I usually advise that maybe move the bath to the evening. They find it soothing. You can do your soft music in the background or a baby massage, breastfeed, and then try and put the baby into a cot to sleep. It's also important to simulate nighttime. So in the evening, don't use bright lights. Just keep the room very dark and dim. You breastfeed, it's a business. It's not time to play. So even if the baby starts chatting and cooing and it's really cute, but not in the middle of the night. During the day, you keep the house bright. You keep the curtains open so that the baby can start differentiating that you respond to her when it's bright. And then it will hopefully get her into the routine where she wakes up at night, breastfeeds, fall back to sleep. But during the day, her awake cycles are a little bit longer. Having said that, sometimes it is a bit challenging. Babies are not the same. It does take a while. And most babies still breastfeed quite regularly for the first year of life. Most babies don't sleep through until they are way closer to a year of life. So just be kind to yourself, but routine is important.
And how do you soothe a fussy baby who's struggling with colic? Because, we see it a lot. They struggle with colic. And is there a difference between a baby who's born through vaginal or cesarean? Is there any difference, or are they the same?
Is this in terms of colic?
No, I'm asking is it the symptoms of colic?
So a colicky baby is just a fussy baby that cries and cries and cries. The true definition is it's a baby that cries for more than 2 weeks, every single night for more than 2 hours. So if we look at it, very few babies really fit those criteria. But I always say that babies are allowed to have a bad day. We all do. So sometimes you'll find once or twice a week the baby will be fussier than usual. My advice is to just check. Sometimes it's just the label on the vest that's irritating the baby, or that hat is now too tight, and previously it was a little bit loose and you didn't pick it. So you remove all of the clothes, you just check, is it the nappy? By eliminating the possible causes. Is it a wet nappy? Is it the clothes? Is she hungry? Does she just want to cuddle and hear your voice? So you go through those steps one at a time. Also, I think mommies need to be kind to themselves and daddies. So if honestly your baby is really fussy and really demanding, which some of them are, it's really important to get help, accept help. And I always say the true treatment of colic is rest for mom and dad. So if you have a grandmother or a nanny available to help you, that would really help so that you can deal with that fussy baby better. The thing with colic is that it arrives mysteriously and it disappears mysteriously. So I promise you, after 4 months, it will get a lot better. You would have forgotten that your baby was very, very fussy in the 4 months of life. Generally, with growth and development, those symptoms improve a lot.
And then let's talk about the tummy time.
My favorites. It's
so cute when you flip them over and then you put them there, and then they're trying to pull their necks up. And then, let's talk about that. Why is it so important? Why are we, why is it the push-ups with those little hands?
Listen, everyone needs to exercise in life, and it starts early. Teach them while they're young. So we actually advocate for tummy time to start as early as possible. Definitely by the time the baby's 6 weeks, you should be you should be putting her or him on the tummy. Minimum 30 minutes. Initially they hate it, and I always say I hate push-ups, but I do them as regularly as I can. So they can get fussy when you put the baby on the tummy. But as time goes on, you'll find that the periods increase. It's to strengthen the muscles. Remember, we always recommend babies to sleep on their backs. So they actually need time on the tummy to strengthen the other muscles. At 6 weeks, you can even put a black and white book in front of the baby, move it from side to side. Then they focus on that, lift up their heads, and you will see the development that as the baby gets stronger, it starts off with lifting over on the forearms, and then suddenly they're able to push up with their hands. Suddenly the chest is up and they look like a crowbar, and the head is nice and strong. So you actually see the progress with doing that exercise. It's also a prerequisite for some of the other milestones where babies start crawling and things like that. So it's really just exercise. Let me just summarize it like
yes.
that. And the sooner you can start, the better it is long term.
Yes. Now let's also talk about the importance of pediatrician visits. Okay. You know, those I used to hate them because you just, you know, you're so nice and sweet, and until you have to inject the baby, how important it is for those visits to happen.
So those are important in order to screen the baby for certain conditions that we are not able to see earlier on. It's also important as an educational platform so that we can discuss any concerns you have as a mom that you've picked up, and also screening to make sure the baby is growing well, gaining weight appropriately, developing appropriately. There's a lot of things we look at, and just by observations I can pick up a lot of things on the baby in those visits. So we tend to see babies quite regularly, especially in the first year of life. Thereafter they're more human, and mummies are able to pick up things more often, and the visits become less and less and less. Obviously, within that period as well, there are visits where the baby needs to get vaccinations. I think that's the injections you're referring to. Yeah, and that's also very important to protect the baby from vaccine preventable illnesses.
Any advice you would give, just, you know, that bonding time between, you know, your as a mom, and not just moms and dads with their babies, how important it is, that bonding time with them? Any tips you can give them?
Yeah, sure. It's very important. I think intuitively, mummies and daddies do quite well when it comes to bonding. In terms of, I would advise that it starts directly from after the baby's born. So if you are able to have a drama-free delivery, it's great to get the baby to be put directly on your chest immediately for skin-to-skin contact. Within 2 hours is what we advocate for.
What is skin-to-skin?
So that is basically when the baby is taken out of the womb and put directly on the mom's chest, on her skin. So we advocate that within the first 2 hours. Sometimes if the baby's born by a cesarean, the theatre is cold, so it's delayed a little bit. But as much as possible, that is where the bonding could and should start. And the dads are not left out in that. Later on in the day, the dad can do the same. So the baby must be directly on your skin, and then you just cover the baby with your blanket. After that initial day of delivery, then it's just being responsive to your baby, as I mentioned before, singing, talking. I know they make funny sounds and they gurgle and coo, but just responding, but because those are the prerequisites of speech. When she sees you smiling and talking to her, that's a way of understanding each other and bonding. And then singing your little lullabies and playing, and also just remember that quality versus quantity. So for a working mom who only has an hour after work to bond with her baby, that 1 hour of non-divided attention is more valuable than spending the whole day, but you're actually not responding. The baby is somewhere there in the corner in the cot, and you're not actually spending time responding to her needs and what she wants at the time.
We're going to a flu season. You know, there's this new flu going around. Does it affect babies? Do you have maybe patients who are coming because of that flu? And what are the symptoms, and what can we do to protect our little ones from getting it, if there's anything like that?
So it is flu season. Every year flu season starts around April, May, June, and peaks within the winter seasons. The thing with flu is that it's just one virus. There are other viruses that are circulating at the moment. A big one in babies is called RSV. There's also rhinovirus that circulates at this time. So influenza or flu is just one of many.
Okay.
The one thing is that it's hard to differentiate by just examining the baby which virus it is. The symptoms are similar: stuffy nose, blocked nose, runny nose, fever. When it gets more severe, you'll find the baby will be a little bit cranky because of the joint pain. Fever is a big one in children. Poor appetite. Loss of appetite is a big one as well in babies. So with a baby at home, I would advise you to apply the principles we learned during COVID. So hand washing, barrier methods, the universal principles of preventing the transfer of viruses. That's what it would do. If you have a sick person indoors, to try and, do your masks, not expose the baby to that person. The other thing with influenza is that there is a vaccine available. The only difference is that you have to give that vaccine every year because the flu strain changes every year. The vaccine is available from babies from the age of 6 months. For younger babies, then it's a very good strategy that the whole family or anyone in close contact with the baby gets vaccinated. So you almost create a cocoon around that infant to avoid her getting sick. So I know that at the moment everyone's talking about this new flu, but I think it's the season, and with the lockdowns during COVID, because we are not interacting as much, probably our immunity waned a little bit, and that's why more of us are getting a little bit more severe flu this year than we were in previous years. But as we interact more, there's obviously no lockdowns anymore, then you'll find that hopefully the symptoms will be better next year. But just remember that viruses want to survive in the community. They are looking for people like us to infect. Every season at this time of the year, we almost expect that it will happen. It's just to make sure that we do the necessary protective things to make sure that it's not severe. And flu is like other viruses, where it can affect some harder than others. So people with low immunity, comorbid conditions, so like babies with heart conditions, infants can get more sick than a well child who doesn't have coexisting conditions.
Lastly, any advice you would like to give to our moms, whether it's a mom who's got it all figured out or a mom who is struggling? Because I know that first 6 months it is hell, and especially whether you have help or not, at the end of the day you are the one who is responsible of taking care of this little one. Any advice you would like to give parents, not just mom, parents?
So I would say that I would advise you to trust yourself more. I think we had this conversation earlier where I think there's a reason why a baby chose you to come into the world. And because of that, you're a correct fit to nurture and raise that baby. So I think that be kind to yourself, rest, eat well, accept help if you have it, and just know that you've got this. You know, you've got this. It's a beautiful journey. Try and not be hard on yourself. I think moms just want everything to be perfect all the time, when in fact just being a mom is just an absolute joy. It's a privilege, you know, to nurture this little being, and you must just try and enjoy it more than stress about it. I find we put so much pressure on ourselves, when in fact just being you is more than enough.
And then I also want to touch on one thing that I've noticed, that even when the baby is 6 months, we sometimes watch TV with them, or you know, most of the times we're on our phones and you're feeding. I know that the screen time is basically for the toddlers, but does that affect them in any way, whereby maybe you're sitting with your child within that 6 months and then they see that TV flashing? Does it affect them in any way, or it doesn't matter?
As much as possible, I'd strongly advise you to avoid screen time for all infants. Even toddlers, we only say 30 minutes a day of screen time from the age of around 2. And we also prefer the kind of screen time where they can interact. So if granny does a video call, that's the perfect screen time, because we like interaction. We don't want the toddler to just be watching a screen and absorbing only without interaction. So infants need you to respond to them. So as much as possible, I know we're busy on our laptop trying to respond to emails and things like that, but as much as possible, if you can avoid the screens for tiny babies, that's the advice that I would give.
Okay, thank you so much, Doctor. To be kind to yourself and always listen to yourself, and let's be positive and raise those cute, lovely babies. Thank you.